And let's move on to the second question. Is it possible to predict the demand on diagnostics and testing market over the next few years? So again, Dr. Park, what are your predictions on the demand for especially COVID-19 testing?
To get the consumer perspective or clinical laboratory or hospital perspective, I've talked with the industry and infection specialists. Let's do not talk about some countries' political situation or policy situations. Infection specialists told me that it would take at least 3 years of COVID to settle down as a endemic disease from epidemic. So demand for COVID would diminish but not go away. It is a professional view. And the other industry view, IVD industry sources are talking about that it will last more than 5 years at 30% peak capacity. And this is the Korean perspective. So COVID will not go away easily. Remember that the very small people are making COVID flu hybrid or combo testing. Combination could go far. Molecular market could shrink, but molecular POC would have its role. Point of care antigen antibody test could have a relative increase in its role.
Thank you, Dr. Park. That is very helpful for our establishing any strategy in our laboratories. Thank you again, Dr. Park. And Dr. Kwon, how do you see the demand changing for the general IVD market globally?
Okay, so globally, let's think about past, present, and future. So it has been growing fast, but it will be faster in the future, I think. So the year 2001, the total IVD market was 25 billion, and past 20 years it actually grew 4 times and reaching more than 100 billion. This growth is basically fueled by rising of geriatric population, and therefore the chronic disease and also increase of the infectious disease. So that will be the factor. But technologically increasing adoption of fully automated and POC instrumentation in developed region is also one of the reasons. And growing awareness of regarding disease diagnosis in developing region is following. And also, growing R&D investment by all these IVD players, developing new innovative, diagnostics. That's also an important fuel. And in addition, I think the regulatory pressure of the personalized medicine, such as companion diagnostics in oncology, will be also adding potential growth of the market. So that's the general. But after we got this pandemic. And it is actually fueling and leaving a lot of important things for the IVD industry. So it was $80 billion in year 2020, the total IVD industry. But within 1 year, we experienced 25% of the growth, reaching $97 billion in year 21, and then it will grow to 150 billion in year 28. So it is like a CAGR of like 6.3%. This is like a much higher than the estimated compound annual growth of 2.9% without pandemic. So why, and it is mainly due to the massive COVID testing. But I'm not sure I should say like due to the pandemic or like thanks to the pandemic. We human have experienced like a real first time, population level IVD testing. So, pandemic forced us to, increase investment in all 3 areas of IVD, diagnostics, like a core laboratory, testing, like a GC laboratory, and POC molecular testing, and even, antigen self-testing at home. So, more importantly, it implanted clear notion of benefit of IVD industry for fighting infectious disease to the general public. Also, we were forced to experience some of the amazing telemedicine approach, thanks to quarantine requirement in the country and the world. So all these will fuel faster growth of IVD industry post-pandemic. I think that one of the potential challenging factor could be the unfavorable reimbursement scenario. So basically limitation of the government finance. The economic factor is always at the core and essential of the healthcare decision. For example, in Korea, authorities didn't like this self-antigen COVID testing because of the debatable performance. But it was like 4 times cheaper than RT-PCR and eventually being used now. So proof of health economical benefit of IVD testing will be more and more important for patient care. So thinking about the future with all this legacy, this economical reason and the limitation of the public healthcare insurance budget, changing the payer from the government to individual can also the fuel growth of the IVD industry into the next level. So I think we partly experienced this for COVID testing for travelers, who pays testing from their own pockets. Utilizing the infrastructure of this massive testing and telemedicine for various personalized healthcare applications should be a good growth opportunity in the future. At the same time, it would provide a stronger social defense system for next new pandemic.
Appreciate your insightful comments, Mr. Kwon. And Dr. Ko, if the demand for the IVD increase after the COVID-19 pandemic, more specifically, in which IVD area do you expect the demand to increase?
Thank you, Dr. Lee. From a public health perspective, other pandemics, and especially given the rise of antimicrobial resistance, will certainly require innovative and affordable diagnostics. It is then fundamental to keep developing and manufacturing large quantities of tests. As you know, AMR is one of the top 10 threats to public health. Currently, 700,000 deaths every year due to drug-resistant strains of common bacterial infections. The landmark AMR review predicted that within a generation, AMR could be responsible for 10 million deaths every year. Diagnostics enable the optimal use of existing drugs and the protection of new treatments. The research and development areas for IVD on AMR based on WHO consultation meetings are a simple diagnostic test flagging the presence or absence of a bacterial infection, which can dramatically cause antibiotic overuse. Second will be the simplified phenotypic identification and AST to enable the performance of blood culture and AST in key resistance categories, in particular in bloodstream infections like sepsis. And the other research area will be the multiplex platform to identify bacterial pathogens and perform AST resistance testing with the cultures. Thank you very much.
Value of your information, Dr. Ko. And Dr. Barton, in light of your experience as CEO of international organization related to healthcare, how do you expect the demand to change?
Yeah, I think the markets are going to change fundamentally, and Dr. Go, some of those points at the end there, especially around antimicrobial resistance, is going to be one of those drivers, isn't it? And so, very quickly on the European market, high demand, high expenditure, and market size will continue to provide strong motivation for people to focus on that market for expansion, but most specifically into the Eastern European markets. But focusing back again on Africa, because that's where I come from, is more than half of the world's population growth and between now and 2050 is going to take place on the African continent. And already in the African continent, more than 50% of total healthcare expenditure is self-funded, as patients actually either paying directly out of pocket or paying into some form of health insurance model. And so you're going to see the reimbursement market in the African market burgeon over the next period. And so surely Africa has to be part of the 5 to 10 year business plan for global companies in this space, both for newer market entrants and for the big players that are already on the ground in those regions. Scratching a little deeper though, I think some of the points that have been raised are really, really important. The first one, we are going to see a continuing and sustained and even accelerating ramp up in demand for point of care and near point of care diagnostics, and even for self-testing. We're going to see the emergence of retail diagnostics, where patients are able to walk in. We're already seeing multiple operations of this in different countries. Patients walk in to be tested. We're going to see pharmacists enabled to do testing. We're going to see nurse practitioners, community health workers enabled to do testings. We're even going to get to see mothers being enabled to do self-testing, because that's one of the things we learned from COVID, is that with the right capacity, the right amount of information, and the right products, patients are actually very capable of doing self-diagnostics. The second is we'll see new levels of funding from donors and from governments, but we will see this accelerated increase in self-funded care. And finally, I think we're also going to see a completely different type of healthcare delivery develop in these markets, where urgent/retail care, the so-called micro-hospital model, will become more and more important, with patients seeking urgent and convenient care, and that effortless access being a big driver of growth. It's projected that there'll be over 1,000 new urgent care centres on the continent in the next 5 years, and that those will add an estimated $3 billion into the existing market. So that's doubling in growth just by the creation of these alternate channels. The last one I think we're going to see is the use of point of care in the support of telemedicine. I'm not talking telemedicine of clinician to patient. I'm talking about support to remote clinicians by urban specialists. And often just that ability to provide guidance in the presence of both history, symptoms, signs, and diagnostic data with central professional specialist support will allow patients to be far better treated in remote and rural areas. And so all of these forces will combine to fundamentally change the way in which we build and the way in which we manage clinical programs. We're going to see task shifting to far more appropriately skilled, more available, more accessible, and lower cost health workers. And we're also going to see remote diagnostics enabling more effective triage, seeing which patients need to come to specialist centres and which can be managed remotely. That increasing the likelihood that patients are going to receive faster and more effective therapy, which is what we're all here to do. So all of these will combine to ensure that Africa will remain a very exciting market for the foreseeable future, a market in which we will see increased affordability, equitable access, expanded disease focus, and improved outcomes being the consequences of our efforts.
Yeah, thank you for this very enlightening information, Dr. Barton. And Dr. Kwon, what are your thoughts on the innovation required for the growth of the IVD market in relation to Dr. Ko and Dr. Barton's opinion?
Yeah, so we need to identify the technology that can actually achieve important problem solving, especially in AMR. So these antibiotics are really asset of the human beings. It shouldn't be wasted to resistant pathogen. So this susceptibility test is very, very, very important. In the hospital, for the first time prescription, 40% of the antibiotic prescribed in the hospital is ineffective because of this, high resistance ratio for the broad spectrum, antibiotics. And I'm not just talking about like superbacterials. And also, even in this country, we got antibiotics for the cold, it's a virus. So really, this antibiotic stewardship is, very important. But technology-wise, getting the susceptibility fast is really important. My company and laboratory developed, one of the fastest, antibiotic susceptibility tests for the patient with sepsis. But it takes like after 1 day, a few hours after 1 day of the blood culture. It's not enough. So, recently the Longitude Foundation in, England called the global challenge. Whoever developed like 30-minute, AST testing, got $3 million. I think this kind of technology innovation is necessary to reduce the AMR. And also, I'd like to point out the population level testing can be very effective and economic defense system for next pandemic. So regarding the social defense system for next pandemic, the Paul Romer, who was a Nobel laureate in 2018 in economics, proposed that the cost of the universal testing will be orders of magnitude cheaper than the economic cost we need to pay by the lockdown. So he proposed like every day 5 to 7% of the population tested regularly without doing the complete economic lockdown will be much cheaper. So this kind of population level testing, having the infrastructure for this population level testing will be really good preparation for next pandemic. But even without pandemic, I think the innovation in sample collection method and also sample logistics will drive IVD industry into the next level. As I said, like it will enable paid by individual, like a direct customer IVD. So we experienced in US, shallow nasal swab instead of the like a deeper nasopharyngeal swab, can be done for the COVID testing. And if you take a biological sample, not just COVID swab, but like a blood or the other sample specimen without healthcare professionals' help, with help of the innovative technology. We can not only provide population level testing as a next pandemic preparedness, but also utilize this for the various personalized health care application. So we can imagine GC lab serving not just patient and medical doctors, but also healthy individuals, surely with authorization of the medical doctors in the future.
Thank you once again, Mr. Kwan.